morning, everyone, and welcome to St. Luke's Sunday Forum. I'm so very happy you're here, and I'm so very glad that we have another opportunity to have a conversation with Dr. Jodie Guest. Dr. Guest is our newest best friend at St. Luke's. She is a professor and vice chair of the Department of Epidemiology at the Rollins School of Public Health at the School of Medicine at Emory University. She also is a very important advisor to the diocese, to the bishop, in developing our diocesan protocols, which impact exactly what we do here at St. Luke's in terms of worship, any kind of worship, and how we think about coming back together for physical worship. So lots to talk about. This is in the series of forums called Where Are We Now? And we've talked about where are we now after the presidential election. We've had a forum on where are we now with vaccines with Dr. Evan Anderson. And now we're talking about where are we now with the coronavirus with Dr. Jodie Guest. Jodie, thanks again and welcome.
Thank you so much for having me. It's a pleasure to see you again.
It's really good to see you too. So this is prompted by all of the news about how we may be, or we definitely are, in this third surge. And can we start there and you tell us how you're seeing it all?
Sure. What we see is just astronomical growth across the United States. And we are at numbers that are much higher than we ever saw in the spring or during the summer, both of which we hoped would have been our peaks. But instead, we are climbing, and every day we're setting new records for numbers that we see. This is both in terms of number of cases. It's also in terms of number of hospitalizations. And while we're not setting new records for deaths, thank goodness, we are still, we've reached some grim milestones. 250,000 deaths were surpassed yesterday. And we are at this threshold of over 1,000 deaths a day, with some predictions that we're going to be hitting 2,000 deaths a day in the next 1 to 2 weeks.
That is so startling, and it is grim. And oh my God, I want it to get all of the attention of all of us.
Yes.
It has been so sad at how much it's been minimized in certain quarters and in certain areas. And I'm really, really grateful for the advice you've given us in the Diocese of Atlanta. I think we've taken it very, very seriously. And I'm just really grateful for your service. So what happened, Jodie? Why this surge?
So, you know, we can take numbers back and we can say, well, death rates now are really from 21 to 22 days ago. And so there's, you know, some ways to go back and look at some of that. And a lot of people would like to say, well, that was Halloween. But in reality, that may have added some numbers, of course, as people gathered, although it may have been one of our safest holidays in styles to be able to gather. What we really see is just pandemic fatigue. People are tired of this, and they're tired of wearing their masks, and they're tired of staying socially distanced. What we also see is that as states have gotten colder, people have moved indoors. And the South is a little different than that, in that we can still do most of our activities outdoors if we so choose. But when you do move indoors, what you're doing is you're expanding the reach of the virus and the chances of everyone around you catching it. And additionally, compounding all of this is we have very troubling messages that are coming from national leaders in this country who are not giving us consistent, solid science information. And we're not seeing a lot of positive prevention messaging that is being consistently given out across the country. And I really do believe, while we'll never be able to prove that that has been part of this, I feel very deeply that it is. And I feel that that is incredibly unfortunate.
It truly, truly is. And with the pandemic fatigue, have we just let our guard down across the country?
I think so. I think that, we're seeing really rising cases in states that weren't seeing it before. Some of those states have some have turned the tide and decided to have some pretty significant prevention measures put in place. Some are still really denying the need to do that, and that's hard to watch. But yes, I do think we've let our guard down. As the virus has traveled across the United States and hit different states differently, I think sometimes it takes groups unaware that, oh, it might be coming here. And so, we talked about New York for so long and maybe just the Northeast, and then it moved to the Southeast. But the Midwest stayed pretty clear for a very long period of time. And so I think it gets easy to get used to that idea. And then when it hits, it takes off very, very quickly.
Wow. So is it too reductionistic for me to say that the coronavirus itself has not changed that much? It's just that we have not been of one mind about how to protect ourselves and our human family from it?
That's correct. I think that, we've had scattered messaging. We have not been of one mind about what to do with this. A virus has become political and divisive, which is not something that should happen for all of us. And the virus doesn't see the difference in political viewpoints and doesn't see the differences in the way we vote and all sorts of other things that people want to hinge this on. The virus is interested in spreading. And so it's going to do that to all of us. And we all have a role in trying to make sure that we stay safe and that our loved ones stay safe and that our communities are staying safe.
Talk about, it seems to me, and check me please on this, that we've gotten really much clearer about the efficacy of mask wearing.
That's
it's
correct.
Almost as if, I'm still washing my hands an awful lot, still disinfecting. Still, I get my temperature taken every time I go into somewhere like St. Luke's. Social distancing, all of that. We live in a high rise here in Midtown, and I just don't get on an elevator that has more than 3 people. And if nobody has on a mask, I say, I'm sorry, my doctor won't let me ride an elevator with people who don't have a mask. I'm trying to teach a little lesson there, obviously. Nevertheless, I just keep hearing masks are really almost the super agent here.
They are. And, our mask wearing conversations have changed a lot over time. And so one of our stumbling blocks at the beginning of this was no one needed to wear a mask unless they were a healthcare provider. And that message has been hard to come back from. And it's been hard to come back from and have everyone embrace it. A lot of people have. And so that's fantastic. But that messaging could have been handled better. And our change in that messaging could have been handled better. There's no doubt. But now we have really great evidence, or we did have pretty quickly very great evidence that our masks, my wearing a mask would protect everyone else. If I were to get on an elevator, it protected them. We now have additional evidence that shows, and we anticipated this, but we didn't have the data to show it yet, that the mask also protects ourselves. And so it is not just you I'm protecting, it's also myself. And so if we haven't been able to appeal to you to wear a mask to protect those around you, we now need to appeal to you to wear a mask to protect yourself. So I cannot stress how important mask wearing is and that we'll be wearing them for a while. We need to get really comfortable that this is what we need to do to help control this virus, and that this is something that every single one of us who wants to help can do. And all of our communities are safer the higher percentage of people who are wearing masks. So we need that percentage to be up really high in order to keep our community spread down. The other thing to think about with prevention is that mask wearing is, I think, one of the most important things that every one of us needs to do. But we have something what we call a Swiss cheese model. So if you imagine a whole bunch of layers of Swiss cheese being lined up, they all have holes. Those holes don't all line up in the same spot. And so what you're doing is you're putting prevention measure with prevention measure with prevention measure. So as the virus, if it tries to get through, it has to squeak through all these different holes, and every single one has a different way of trying to stop it. And that's really important. So that's your mask wearing, that's social distancing, that's being outside or somewhere that's well ventilated, that's washing your hands, that's not being with very many people, that's limiting the amount of time you're with people who you don't live with, that's having a conversation about with the people that you're going to be with about what they're doing to stay safe. So every single one of those things is another layer of Swiss cheese in our prevention to try to keep the virus from getting from an infected person to you.
Thanks for that. That's really cool. That's a wonderful thing to keep in mind. Yeah, I'm just amazed. Jodie, I'm buying masks as Christmas gifts, fashion masks. I mean, my favorite bow tie place is now manufacturing masks. And the whole idea, that 9 months ago, I would be ordering masks as Christmas gifts. So masks really are going to be a part of our future.
They really are. And we've got vaccines coming our way. We've got incredible data from 2 vaccines and some others that we were very hopeful about that are following quickly behind. But we're going to have to get to a substantial proportion of our communities who are vaccinated before we don't want to also be wearing masks. And so even when vaccines get rolled out, it's going to take more than a minute for us to all get them. It's going to roll out in hierarchical groups of risk, and appropriately so. But we all need to wear the mask until we get to a certain density of vaccination in our communities. And so that is a perfect Christmas present. When you find the mask that you like, get a whole bunch of them, make sure they match all your outfits, and that you wash them regularly, because they are going to be with us probably through all of 2021.
Well, I have had in my mind that the earliest we can think of as the Eucharist, where we get all back together, is a year from this Christmas, if that's soon. But I'll tell you, I learned something about the human will and desire to get together. As soon as I heard about Pfizer and then Moderna, I thought, well, maybe Easter. And but this other wiser voice inside me says, calm down. Let's take this a month at a time. Let's see what happens.
I think if we aim for Christmas, Hanukkah, Kwanzaa, 2021, maybe we'll be surprised and it'll be a little earlier. But if we set our goal for that, hopefully we will be grace-filled the entire next year as we wait.
I love it when you talk theology. So let's talk about Thanksgiving.
Sure.
My wife and I, moved to Alabama to be near grandchildren. And we have grandchildren in New Orleans. And for the first time ever, we're thinking about having Thanksgiving without any of them.
Yes.
And I talk about the Dr. Fauci model when he said it was just going to be him and his wife, and then they were all going to get on the Zoom in the afternoon. So I don't want to put you on the spot for you to tell me how to spend my Thanksgiving. I really do, though, Dr. Guest, want you to talk about what all of us should consider, because this is going to air this coming Sunday, 4 days before Thanksgiving. How should we think about our Thanksgiving gatherings?
Sure. So I am not traveling for Thanksgiving for the first time, other than 1 year in grad school when I was too poor to travel. This will be the very first Thanksgiving I'm not spending it with my family, in my extended family, or I'm sorry, my original family in Kansas City. And so I will be with just my kids and my husband here in Atlanta. And that is sad. I am sad about it. There is no way around it. But I want to celebrate with all those people I love next year. And I don't want to be part of a risk for anyone else. Frankly, also my family lives in Kansas City, and they've got substantially higher risk right now than I do in Atlanta. And so it's risky for me to go there as well. So I've made the same sort of decision that the right thing to do this year is to limit the number of people that we're seeing. That to me is a signal of my love for the people I would normally be spending this holiday with. And I think for me, it was the right decision. For those of you who are considering what to do for Thanksgiving, CDC did just put out a plea to have people not travel for Thanksgiving, and they put it out yesterday. And so I'm very grateful that has come out. It would have been nice to have seen it a couple of weeks ago for people to plan differently. I've also heard that the vaccine information has made people say, all right, maybe we can, travel. Well, we don't have the vaccine yet. And even if you're in the trial, everyone you're with is not going to have had it. The thing to consider is everyone you get together with who is not a person you normally live with, you are getting together with not only them, but all of their risks, all the people that they've been with. And you are bringing to your Thanksgiving dinner with them all of your risks. So if I go into work and I see 4 people, and those 4 people have seen 5 people, I'm bringing all that risk with me when I come, unless I have quarantined for 14 days before I go somewhere. And I have not. And I didn't have the privilege to quarantine like that for 14 days. And so I'm not doing that. That's my personal decision. But everyone who makes a decision about what they're doing for Thanksgiving should recognize that your bubble of what you think is your safe zone comes with you, but your bubble is likely bigger than you think it is. And so that's the kind of spread we're talking about. The other thing to consider is we've talked a lot about trying to keep numbers below 10, but 10 does not equal 10 all the time. So if I have 4 people in my family and I get together with another family of 4, and then you and your wife come to my house, so we now have 10, I've got 3 households there. That is different than having 10 people from 10 different households come together. So 10 is a great number to try to stay below, but all the different varieties of 10 do not equal each other for risk.
I really appreciate the metaphor of your bubble is larger than you think it is. Mm-hmm. That's precisely why we're almost certain that it's just going to be my wife and me, because all of our kids work outside the home and they are with the public and with other kids and. So, gosh, I'm really, really grateful for your putting it that way. That's very, very helpful. And I want to really publicize the fact that we're having this conversation.
Can I add one more thing to that?
Oh, please.
As we see our, one of the markers that I'm consistently always watching, everyone in public health is the percent positive tests. And so at any given time of all the tests that are being run in a particular area, what percentage of them are positive? If that gets below 5%, that is our threshold for thinking that we can contain the virus without a lot of community spread by masking, social distancing, and all these things we're talking about. When it's above 5%, you've gone beyond the ability to do efficient contact tracing and to slow the spread by just those measures. And so there's almost nowhere in the United States right now that has community spread that is below 5% in the positivity of tests. And that's the other thing to consider. There's a lot of virus out there that people don't know they have. And we know that from this marker. And so you might get together with folks who say, I don't feel bad. I don't think I have risk. We have a large percentage of people who will be asymptomatic, but we also just know that there's a great deal of undiagnosed COVID out in communities.
Thank you. Has the virus changed, or has it always had, to quote you, that the virus is interested in spreading and that's what the virus is? Or has there been a change in this particular virus?
Well, and I probably cartooned the virus a little bit too much when I said that.
I understand.
It's very easily spread, and it has been this entire time. our knowledge of it has changed, and that's what's changed. So science is an iterative process. We should always be learning. We should always be course correcting when we learn new things. And we've learned a lot. We've learned that in March, when we were housing our mail outside in our garage for 3 days and then spraying it down with Lysol, probably not anything we needed to have been doing. It didn't hurt anyone. Our mail was super clean, but our mail didn't need to be clean. Our mail is not an efficient method of spreading coronavirus. We now have more information about how we can spread it through the air, and it is easier to spread through the air than we originally thought. That is our primary method of transmission. We also didn't originally think that your eyes were a problem, and they're still not your primary method of being able to get it, but if you were traveling and you were going to be on an airplane, I would want eye protection when I did that. It does not replace your mask protection, but it would be an additional thing I would do if I were in a high traffic area. Those things are new. Those things are not things that we knew for sure back in March. And so we are learning. We are learning that surface contact is not one of the best methods. But anything when we're speaking together, the more excited we are, the further we can spray the virus. A big belly laugh is a super great way to give it to someone. And so the holidays are going to be a great way to spread it, because we're going to be eating and drinking and laughing and loving each other and wanting to get next to each other. And that's human nature. And those things are all really easy ways to spread the virus.
I don't know if you and I have talked about how we adapted to the point that you were just making. I call it exuberant speech, along with singing. And so as a result of that, we and our preaching staff, wanted to be able to preach without masks. But two of us are very exuberant preachers. And so we go to a completely different room and take off our mask, and nobody else is in that room, so we can do that exuberant preaching. And I just thought you'd be proud of us for doing that, Jodie.
Absolutely. Yeah. And we all have to be creative to think about how we're going to do these things.
Yeah.
That's a really important thing to be able to do. I've been teaching in person this semester, and I first was teaching using a face mask. And what I found was first of all, my face masks weren't staying on my face when I talk to a class the way they do when I just am out, at the grocery store or somewhere. And so obviously I am a much bigger speaker and my mask didn't fit as well. The other thing I learned was I inhale really hard when I'm talking and presenting, and I was inhaling my mask. And so that was super uncomfortable. So I had to come up with a new way to doing it. And so we had, anyway, I won't go through belabor the points, but yes, I get it. We have to figure our ways around some of these things.
I am curious, did you start wearing a face shield?
I did start wearing a face shield, but that by itself is not sufficient. It had to be a face shield with an exceptionally far distance between me and students in order for that to be sufficient.
I see.
Yeah, because the face mask is better than the face shield. But if I then moved where I was to a sufficiently further space, then a face shield became sufficient.
I see. Well, so much to learn. Let's stay with the learnings. I don't know if in our first conversation or not, Arundhati Roy had come out with her really mantra-like essay, which is named Pandemic as a Portal, or Pandemic as Portal. And she's arguing that there are so many things for us to learn during this virus. And it is actually a new world into which healthy behavior is calling us to enter, and an old world that some unhealthy behavior is asking us that is smart to leave behind. I didn't say that very well, but you get it. And I'm using that as a mantra. What is everybody learning? What are you learning that you're supposed to learn? Clearly, for me, theologically, the myth of the separate self is dead in this thing, because if you continue on with this hyper individualism that I can do whatever I want to, and I'm really not a communitarian being, that's old world thinking. That's just not, can't be supported by the science. Are there other things that you've learned and that you think we're learning?
I do think people may be understanding their connectivity more. And the virus is helping us see that, for sure. You know, we're all connected in so very many ways that might seem insignificant during the day. The virus doesn't think those connections are insignificant. So they help to point that out. I think we've all had to slow down to some extent. And, you know, that has been hard for a lot of us. That has been really hard for me, although I'm not positive epidemiologists have necessarily slowed down during this time. It has been, so just speaking for me personally, I've had to learn how to adapt to connect to people. I'm very much an extrovert. And so the idea of not seeing individuals on a day-to-day basis in person has been hard, but learning how much more I like a Zoom call than a phone call has been important. I think we've learned, like my research staff, we've learned that we telecommute and are incredibly efficient doing it. And we have actively not telecommuted before. I've learned how far I can go on a tank of gas because I don't go anywhere anymore. You know, so there are all sorts of things we've learned. From a community perspective, I think we've learned how much we are connected and how much some people don't think about others. And that's been the hard part to learn, how much people value their independence over their connection to others, has been a striking point of view for some. And then how much people are willing to jump in and say, I will do anything I can to protect my community and the people I love and the people I have never met before who I value. That's been beautiful. So, you know, there are positives and negatives to this, but our connection, we cannot underestimate. And this virus has made us take a moment to really recognize it.
I'm finding myself over the course of my pandemic Sunday forums by video and Zoom, that when a guest says something that moves me, that I need to stop and breathe. And what you just said is one of those occasions. The multifacetedness of our connectivity, and how the multifacetedness of our selfishness and our hyper individualism. And thanks for bringing up, Jodie, the business about introversion and extroversion. I'm what I call a gregarious, boisterous introvert. And so I'm cool with a lot of solitude. I have friends who are dying because their batteries get charged by being around a group of people. And folks are saying, come on, let us back to church, blah, 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 blah. I need socialization. I'm also discovering, I have this little Wednesday night class, I call it a little Wednesday night class. It's really an amazing class that I've been doing ever since I've been interim rector. And last Wednesday night, we had almost 100 people. And we have 45 minutes of just checking in before there's a formal PowerPoint presentation that I create. More and more people really, and I too, even as in my introversion, really feel an internal energy change by being able to be on Zoom. And I, like you, I much prefer to send somebody a Zoom invitation, even if it's a 5 or 10 minute conversation, you know, rather than a phone conversation.
Yep.
Yeah.
Yeah, absolutely. I spend most of my weekends doing COVID testing in different parts of the state, and it says a lot about the way I get recharged when I can't wait to go because I feel like I'm doing something helpful, but I also get to see some people in person. So yes.
I love it. Yeah, I'm working at the church today, and I went down to the kitchen to have a snack, and there was somebody there. They're preparing a Thanksgiving meal for these wonderful people, and I said to this person, if we didn't have this pandemic, I would have been hugging you so tight, And she and I were on the opposite ends of a huge kitchen. It's just I stop and think, wow. This is a different world than I ever, and a different way of living than I ever had anticipated.
Yeah.
It's just amazing.
It
And
is.
it's not over.
No.
And I appreciate your saying what you said about mask wearing beyond the beginning of the vaccination process. We need to get to a critical mass. I'm assuming, I know you all will tell us what it is before we can sing again, and all those kinds of things which we desire. That's another thing. I want to sing and hug.
Yes. Absolutely. But you know what? Instead, what we can do is we can intentionally tell someone.
Can what?
We can intentionally tell someone what they mean to us, as opposed to like you just did, to your friend in the kitchen. I would hug you. That is an act of it, even if you physically aren't doing it.
I love that. I love that. And it is creating all sorts of wonderful things. We're going to be having a joint book study with Ebenezer Baptist Church during Lent. And our choirs are going to be doing virtual choir stuff.
Oh, nice.
And I don't think that would have ever happened. And so I believe in the sacramentality of absolutely everything, even something that's as uncomfortable and also lethal as a virus like this. And it's been an important spiritual discipline for me to ask myself, what is the grace inside the coronavirus? And I land up exactly where you did. It has to do with human connectivity. Mm-hmm. I think that's the thing. Anything I didn't ask that I should?
Oh, no, I don't think so.
Well, you've been so good to generously, again, give us some time. Thank you very much, not only for your science, your expertise, but your wisdom and your theological reflection. I really appreciate that in you too.
You're so welcome. Thank you for making sure that we get really good information out. I appreciate the time and effort that you are doing to make sure you're protecting those who are in your congregation and others that they will then come in contact with. So thank you for that.
You're very welcome, and thanks for saying that. Have a great weekend.
Thank you, you too.
And thank all of you for joining us for Sunday Forum at St. Luke's. Have a great Sunday. Bye-bye. I always love hearing from Dr. Jodie Guest. She is so transparent and teaches so much. Now, I want you to get a taste of another forum that has been taped. And it is about another virus that we have, the virus of polarization and the scorn between the two divides in America and how we can talk across the divide. And the key word is how we can be safe in having those conversations. So here's just a taste from my conversation with Julia Green. And then later today, you can have the full link and watch it at your leisure. But I think it's really good preparation for whatever Thanksgiving conversations you're going to be having across the divide in your own family. And as we continue to talk across the divide in our church and in our culture. Thank you. So let's start, Paula, by talking about Hands Across the Hills. Can you tell us about how that happened and what it is?
Well, there's a wonderful origin story. The background is that I live in a fairly progressive community in the western part of Massachusetts. It's just outside of Amherst, which is a big university town. So there's a lot of academics and other like-minded people living here. And after the election, we called a meeting in the town library. We is a small group that, to oppose the Iraq war years before, had fashioned ourselves into a little peace commission for the town. About 60 or 70 people showed up, which is good for a town of 2,000. And we asked people what they wanted to do. And many of them wanted to bridge divides, wanted to understand how it was possible that people voted for Trump who live in our country and why there was so much antagonism. Of course, there was a lot less antagonism then than has happened since then, but already it felt uncomfortable to people. We began searching locally for a conservative town around us. I went to clergy people and I went to social workers and community leaders, and I didn't get any acceptances. And I could understand that in the beginning of 2017, conservative voters did not want to feel attacked, humiliated, or blamed for their vote. And so the project went quiet while we thought what to do. And then one of our members saw online an article by a young man who was from Connecticut, but has a PhD in cultural studies and was doing community organizing in Eastern Kentucky in the area of coal fields. And that was a high Republican vote turnout there. And we connected with him by email and phone and eventually formed a partnership. And without that, it wouldn't have happened, because those of us who are progressive need a partner to do the inviting for us. Otherwise, the invitation won't be accepted, understandably. And that was how we started. That's how we found Kentucky and how we started.
Wow. I'm going to say wow too much. I know I am, simply because this is such a wow-filled story. Now let's move ahead. So you found this community, and as I understand, you all actually got together, Massachusetts folks and coal country folks.
We certainly did. I had to design the program after we had this acceptance, and based on my lifetime of experiences in building peace in conflict areas at home and around the world, I wanted this to give me as much time as possible with the two communities together.